Percocet is an opioid pain medication and is available by prescription. It is most commonly used to help with moderate to severe pain when non-opioid drugs did not provide adequate relief. Percocet is the brand name for a drug that is a combination of oxycodone and acetaminophen. It is also known as Percs, Paulas, or Roxys. While some opiates are derived naturally, opioids such as Percocet are synthesized in the lab. The lab-synthesized oxycodone contained in Percocet is often 1.5 times more potent than morphine. The drug first entered the American market in the 70s as a prescription painkiller, used to help with chronic pain and discomfort due to surgery or injury. Due to this, Percocet became a gateway drug for many people that became addicted to opioids. The drug's popularity continued to grow into the late 20th century and was glamorized by many celebrities such as Migos, Future, and Lil Peep. Since the 1970s, use of Percocet has reached critical levels. Today, over 2 million Americans abuse Percocet and other prescription pain relievers. An average of 130 people per day die from opioid overdose. Although doctors write the bulk of prescriptions, Percocet can also be purchased illegally on the street or on the internet. Percocet sold online or on the street can be fatal, as other popular opioids such as fentanyl are often mixed in without the user knowing, making the drug much more potent and therefore more deadly. Prescription Percocet is meant to be taken orally, but many users snort or inject it for a stronger and quicker high. Soon after taking the drug, the user may experience positive feelings such as happiness, intense pleasure, and reduction of pain. But there are also more dangerous effects, like slowed breathing, which can become lethal, especially when Percocet is combined with other drugs or alcohol. Many people may quickly develop a dependency and start to experience withdrawals when not taking the drug. Percocet withdrawals usually begin 5 to 8 hours after the last dose. Withdrawal symptoms can be severe and vary by person. Some elements that affect Percocet withdrawal are based on the duration of use, dosage, and how the drug was used. Symptoms of Percocet withdrawal can vary from mild, moderate, and severe. Within 2 to 3 days, these symptoms will peak in severity and intensity. Within 4 to 7 days, the physical symptoms will decrease, but the cravings will grow stronger. Even after the end of the withdrawal process, which can last up to 1 month, the risk of relapse remains very high. There are 3 popular treatment options often recommended to patients struggling with Percocet addiction. The first option is a form of medication-assisted treatment, or MAT, using replacement opioids like methadone and Suboxone. These substitutes mask the withdrawals and can be used to reduce the dosages of Percocet. But rather than treating your opioid dependency, you are just replacing one opioid with another. Worse than that, those replacements can easily cause more serious dependency along with stronger withdrawals. The second treatment option includes either staying in a long-term rehab center, a detox facility, or other related therapies such as a support group or a 12-step program. In these care facilities, the primary goal is to help the addict with the symptoms instead of treating the lifelong dependency. It's not surprising why 70 to 80% of the participants relapse within a few months after treatment. The third option is to undergo rapid detox. The goal here is to treat the withdrawal and not the root of the dependency, thus making this treatment ineffective in the long run. Ultimately, Percocet addiction should be treated at its biological root, the brain. With the ANR treatment, we can evaluate each individual and restore their own neurological and chemical balance to a pre-dependency state, effectively eliminating their withdrawals and cravings, defeating the Percocet dependency at its root.